Hi, I'm Dr. Victoria Aimé. I'm a plastic surgeon in Scottsdale, Arizona. One of the questions I get from most of my breast augmentation patients or breast revision patients is, what plane should I put my breast implant in? This is a very good question, and I'll walk through how I explain this to my patients so that they can make the very best choice for them and for you as well. So there are three different planes that are the most common that we use. You've probably heard of the term above the muscle or below the muscle. Above the muscle, there's actually two. So there's one directly beneath the breast gland. We're going to call that subglandular. So that's right up here. There's beneath the fascia. The fascia is basically a layer that's over the muscle, the pectoralis muscle. So we'll call that subfascial right here. And then submuscular means that it's just below the pectoralis muscle. So there are some pros and cons to each different layer. We'll go over them with this little table right here. So number one, do you have to cut the pectoralis muscle for any of these options? Yes. So when we place the implant underneath the pectoralis muscle, we actually do cut the bottom portion of the muscle. And that is so that the implant can settle into the pocket. That's important because if a patient does a lot of chest workouts, they may be concerned about that. So yes, we do cut the pectoralis muscle with submuscular placement, but we do not cut it when we place the implant above the muscle. So that would be with these other two options. The next one is postoperative pain. So whenever we cut the pectoralis muscle and put an implant underneath it, remember your pectoralis muscle is against your chest. So now we're going to cut the bottom of it. We're going to put an implant underneath and lift it off the chest wall. So that actually tends to have the most pain for patients postoperatively. And this is all relative. So this isn't like extreme pain, but the most pain relative to these other two options. So typically I will use Exparel for patients that are getting breast implants placed in the subpectoral plane. The next one is the risk of seroma or hematoma. So seroma is a fluid collection and a hematoma is a blood collection. We actually know that is the most when the breast implant isn't placed in the subglandular plane, and it is lower in the subpectoral plane. And what we know from our data, and this is still being researched, but that it's likely the least in the subfascial plane. The next one is the visibility or rippling that you can see of the implant. So the less tissue coverage you have on the implant, the more it's going to be visible or potentially visible. So that makes sense that it is the most visible with subglandular and is the least visible when it's placed underneath the muscle. The next one is animation deformity. So an animation deformity is essentially when you push your hands together, your chest muscles clench, it will actually pull up your implant. So because the implant in these two, subglandular and subfascial planes, is above the muscle, it doesn't matter if you move your chest muscle at all, it's not going to change the position of the implant. However, when you have an implant underneath the muscle, whenever you contract those chest muscles, it's going to pull the implant up. And that is called an animation deformity. So we see that with implants that are placed underneath the muscle and not with those that are placed above. This tends to be an issue if patients are very avid exercisers, bodybuilders, things like that. It's always something I talk about with patients because some are very, very bothered by it. The next one down on the list is something called capsular contracture risk. So basically, any implant that we put in the body anywhere forms a capsule around it or a little bit of scar tissue. A capsular contracture is a very thick layer of scar tissue. So if you can imagine a dome-shaped implant, what it's going to do is squeeze that implant into a round, hard ball, kind of pulls it up on the chest wall. It can be very painful. So capsular contracture risk is something we look out for. It is highest in the subglandular plane because it is closest to the outside world. So if you think about the breast ducts, go through the nipple and they're open to the outside world, so there is bacteria in them. So placing the implant directly behind that increases your risk for capsular contracture. The farther we get away from that breast glandular tissue, the lower the risk becomes. So hopefully that helps shed some light and give you some guidance when you are choosing your best implant plane. It's something you should definitely talk about with your plastic surgeon, weigh the pros and cons. And I encourage every patient to think about it in terms of their own lifestyle and their own risks and benefits. So choose the very best implant plane for you. And if you have any questions or comments, feel free to drop them below.